Honorable Chair, distinguished guests, and dear audience. It is a great pleasure for me to attend this wonderful conference organized by ICU DDR. And thank you so much for inviting me to present today. The topic of my today's presentation is the implementation of evidence-based treatment and prevention courses in academic institutions of Pakistan. And I am Salman Shahzad, a Fulbright Humphrey Fellow and a consulting clinical psychologist and an associate professor at the Institute of Clinical Psychology, University of Karachi. This is a map of my country, Pakistan, and regarding Pakistan, I got into UNODC. Pakistan is the 5th most populous country with a population of 210 million people. And we have a huge reservoir of the young people, with the 64% of the population below the age of 29 years and 30% between the age of 15 and 29 years. A country survey was conducted by UNODC in 2013, and according to them, 6.7 million people use drugs, and out of 6.7 million, 5.2 million were men and 1.5 million were women. And out of 6.7 million people, 4.2 million people met the diagnostic criteria for substance use disorder. And we have a huge problem now. The adolescents and even the children are using drugs in country, and it is very important for us to tackle this problem as early as possible. And you can see in this country that the slide shows that from where the drugs are coming into Pakistan. To my best of knowledge, Pakistan is not a poppy cultivating country, but unfortunately, these drugs are coming in through the border from the neighboring countries like Afghanistan. And due to this drug problem, and there is a growing concern for the well-being of people with substance use disorder and their families, as well as the young generation of our country. There are many treatment centers in Pakistan, but the major problem that these settings faces are the lack of the trained and qualified professional. Although there are a limited number of trained staff, but due to these limited number, the people with substance use disorder cannot receive the best and evidence-based treatment services. And these limited staff cannot reach to all those people who are suffering from substance use disorder. In Pakistan, Higher Education Commission is the top level institution, and which can recognize the universities and the degree awarding institutions here in Pakistan. Here in Pakistan, HEC recognized universities in public sectors are 131. In private sectors, there are 83 degree awarding universities and institutions. By combining both public and a private sector universities and institutions, we have total of 214 universities in Pakistan. But unfortunately, none of the institution is offering any certificate course, diploma, or degrees in addiction sciences. But the Institute of Clinical Psychology, University of Karachi, is going to offer the first postgraduate diploma in addiction sciences in Pakistan, and which has already been approved by the Academic Council of the University of Karachi. This diploma in addiction sciences would be the first course in addiction sciences, and which will be recognized by the Higher Education Commission of Pakistan. There are the 2 semesters that we will offer in this diploma course, and the course outline briefly is the Physiology and Pharmacology of Addiction Science, Counseling and Psychotherapy, Intake, Assessment and Psychodiagnosis, Case Management, Crisis Intervention, and the Treatment for Substance Use Disorder, which is the continuum of care, and the common co-occurring mental and medical disorders. Ethics is one of the important part, and the internship, and our participants, the students, will go for the psychological assessment and the tool that they will use to diagnose the substance use disorder and the co-occurring disorders. They will go for the treatment center to conduct psychological assessment, as well as the psychotherapy and counseling sessions. And the final one is the research. Once they will complete their diploma course, they will have to submit the research project, especially in the addiction sciences. We believe that by the completion of this course, our participants will be able to articulate a theoretical understanding of substance use and addiction. And they will be critically, they will be able to evaluate critically the theory and evidence-based knowledge when applying it to unique client settings and engaging the clients at various stages of change using the evidence-based intervention. And they will be able to establish the process that encourages clients to be more equal participant in the establishment of treatment goals and expected outcome, and they will be able to demonstrate screening and assessment skills in a scientific way. And they will be able to use the assessment tools and will be able to diagnose the problem, both categorical and dimensional, and develop the intervention strategies and the skills to assist in the treatment of individuals and families affected by substance use disorder and the related problems. And they will be able to critically analyze the ethical dilemmas and controversial research and the practice issues in the field. And they will be able to apply the ethical decision-making skills to issues specific related to research as well as in the clinical practice. What are the steps to get admission in this postgraduate diploma course in addiction sciences? There are the 5 steps which are mentioned in the slides. First is the application, and then there will be the second step is related to the qualification in adequate continuing in education hours. And we are offering this course for those who are the social science students, medical students, as well as the nursing students, and they can apply for this course. And the third one is the test and interview, and the fourth one is the getting admission. And they will be able to attend these classes, and once they will complete their course, especially is the 2-semester courses, and once they complete these courses, and then will go through the final examination. Once they complete this diploma course here at the Institute of Clinical Psychology, University of Karachi, we will facilitate our students to get credentialing in the addiction sciences through the GCCC, the Colombo Plan. And in this regard, you have already applied for all these processes, and also in this regard, we believe that and we hope the ICU DDR will help us and they will facilitate us. It's very important that getting the credential in addiction sciences. For the international credentials in addiction sciences, there are certain steps and they will have to go through, and they will for getting the credential in addiction sciences. The first is they apply for the international credentialing, and we will facilitate in submitting their application and all this process. They will sit in and they pass their examination. As you know, that there are the 3 levels. One is the ICAP 1, ICAP 2, and ICAP 3. And the third one is the getting certification once they pass their examination. And it's not enough to get certified in addiction professional. But again, what we will do in the next phase is the reviewing the credentialing every 2 years with the required continuing education, which is almost 4 years. Here at the Institute of Clinical Psychology, we will offer new certification courses, and they will have to engage in those courses, and as well as they will have to practice in their professional setting, especially in the treatment of substance use disorder. And the next is very important. We will continuously monitor their performance and all these things, because they will remain in touch with us. So it is very important to adherence with the ethical code of conduct in the addiction treatment field. What are the expected outcomes of this diploma course? We believe that we will be able to create the substance use treatment professionals by enhancing their knowledge, skills, and competencies. And this diploma course will enable our professionals to provide best quality services to the people with substance use disorders as well as their families, and those who are at a greater risk for substance use disorder. This diploma course will provide a standard that encourages substance use treatment professionals to continue learning for the purpose of providing quality services. And this will promote the professional and ethical practice by enforcing adherence to a code of ethics while practicing in the addiction sciences. Thank you so much.